Texas lawmakers passed tens of millions of dollars to advance medicine across the state, and we're now beginning to see who will benefit and how. New funding includes a $68 million increase in women's health funding, $31 million more for early childhood intervention, a $50 million increase in funding for adult mental health services, $99 million to establish the Texas Mental Health Care Consortium, and additional $7 million to reduce maternal mortality and morbidity, and $5 million to integrate prescription monitoring programs into electronic health records. Here to help us learn more about what exactly all that money will do for patients and physicians is Dr. David Flieger, an Austin surgeon who's now the president of the Texas Medical Association. Welcome.
Well, thank you for having me.
Sounds like TMA did well with this legislative session. Talk to me about how all of the money that's coming out of what lawmakers did is going to help patients.
Well, several areas. So public health, rural health, mental health. So mental health's a big one, as you've mentioned. A lot of funding going into especially children's health issues. And we've obviously seen over the last few years that Texas has been deficient in that. And so we've got some major funding, consortiums being built that are going to help children and mental health, entire networks to try to help them with their issues.
Yeah, I think for a lot of people, they don't understand what the term consortium really is, but it's involving a lot of different higher education places across the state.
Exactly. We're talking everywhere from hospitals and hospital networks to medical schools to universities, etc. All be getting together to work on trying to coordinate and give Texas a good infrastructure for both mental health and specifically for children's mental health.
Now, we're also talking about young people on the physical side as well. The smoking age was raised to 21.
Yeah, that was a big win for the state of Texas. Tobacco 21, as it was known as, will basically make it harder make it so that you can't buy until 21. We know from studies that if you delay onset of smoking, then you're less likely to become addicted and you're less likely to have the obvious diseases. Ultimately, this is a bill that will save thousands of lives in the state of Texas.
Some things don't always pass, though. Surprise billing, talk to me about that. That was kind of one of those that a lot of people were wondering, is it going to go this way? Is it going to go this way?
Yeah, so that was one of those partial wins for us. As it first was placed before us, it was going to be very onerous for physicians as far as trying to deal with the surprise billing legislation that was proposed. Ultimately, what we came up with is very acceptable to the physicians of Texas. What we're doing is we're taking the patient out of the process. So now the negotiations will occur between the doctors or the hospitals and through an arbitrator, the insurance companies.
What happened to the funding increase for Medicaid eligibility for new mothers from 60 days to a year?
Yeah, so what we were hoping is 60 days to 365 days because there's a significant number of issues that lead to maternal mortality during that period of time. We wanted that to go through Medicaid because that's a known set of benefits. Instead, it will be going through Healthy Texas Women, a state program, and through state funding. So $45 million has been put into that program. Our main concern is how this will come out and how the rules were written. It's certainly not as robust a program as Medicaid is, specifically regarding mental health issues and substance abuse treatment issues. And we're hoping that those will be beefed up a little bit in order to help these women.
What about the opioid epidemic? How did lawmakers try to tackle that this session?
Well, a couple things. Some of them are sort of dealing with doctors as far as we now have to go into a special data bank and evaluate how many narcotics a patient has received recently and from how many different doctors. That's been delayed a little bit because there's some problems getting our electronic medical records to talk to the state, and we're dealing with that. Other ways that we're dealing with it is there'll be a 10-day limit on how much narcotic one can give at a time, and we felt that that was a reasonable compromise as far as trying to take care of the patient's needs and at the same time not giving them too much medication that might be abused at a later time.
We have several physicians in the legislature this past session,
We do.
particularly from here in Central Texas.
We do.
Don Buckingham,
Exactly.
Donna Campbell, Charles Schwartner.
Exactly.
Does that help when you're having these conversations at the Capitol? Can they kind of rally their colleagues?
It does. It does. It helps us to. We speak the same language. There's a legislative language and a doctor language. They have to know both of them, so they help us to interpret. So it helps that. They can help us to put bills forward. But probably more important, their peers look to them because they know the medical issues. They know the science involved, and so we know that their other legislators are looking to them.
All right, Dr. Flieger, thank you very much for being with us.
Well, thank you. Appreciate it.